Glanzmann Thrombasthenia is a rare blood clotting disorder caused by abnormal platelet function. In this mnemonic video, we'll give you an easy way to remember everything you need to know about Glanzmann Thrombasthenia. Whoa, careful with that. Those heirloom glass figurines are super fragile. That's right, these glass men are part of our grandmother's inheritance, so you know they're super valuable. By the way, these glass men will serve as your memory anchor for Glanzmann Thrombasthenia. It's the Glanzmann glass men. Glanzmann Thrombasthenia is a platelet disorder named after the pediatrician Edward Glanzmann, who originally described the condition. Thrombasthenia comes from the Greek roots thrombos and asthenes, which literally translates to clot weakness. So what's the exact defect in the platelets? Let's find out. I know this inheritance is rightfully mine, but I have to prove it first. That's why I'm conducting a 23andMe DNA ancestry test. By the way, 23andMe is our recurring symbol for GP2B3A. 23andMe for 2B3A. Make sense? Glanzmann Thrombasthenia is caused by defective GP2B3A or glycoprotein 2B3A on the surface of platelets. This is an integrin complex and receptor that normally works in platelet aggregation. More on that next. Like any inheritance battle, there's always fighting over the best goods, and we've gotten into a bit of a tug of war for the glass men, knocking right into those plates in the process. See how that stack of plates is falling apart? The plates falling apart should help you remember the impaired platelet aggregation caused by Glanzmann Thrombasthenia, because these plates are failing to aggregate, or stay together, right? You see, GP2B3A is normally the binding location for fibrinogen, which is used to bring together platelets into platelet plugs. Defective GP2B3A impairs the aggregation of platelets, blocking formation of the platelet plug. This leads to an inability to stop bleeding. Next, notice that this 23andMe kit happens to be sitting on a small cart. Here at Pixorize, we use small autos, like carts and wagons, to symbolize autosomal recessive inheritance patterns. So this small little cart should help you remember that Glanzmann Thrombasthenia is inherited in an autosomal recessive pattern. Now, let's talk about how this disease actually presents. If you've done an ancestry test before, you might know that these kits usually require a blood sample. Weirdly, my finger hasn't stopped bleeding yet from the test. The prolonged bleeding should help you remember that bleeding is usually the main clinical finding in Glanzmann Thrombasthenia. Think about it. These people can't form platelet plugs to stop bleeds. Findings include mucosal bleeding, such as bleeding from the gums, epistaxis or nosebleeds, as well as heavy menses in women. You might also see microhemorrhages or little bleeds manifesting as petechia under the surface of the skin. Do ancestry tests normally take this much time? So much that I'm still bleeding while looking at my watch. By the way, the bloody watch here should help you remember increased bleeding time. Get it? Because I'm literally waiting for a long time while bleeding? Laboratory tests in patients with Glanzmann Thrombasthenia reveal an increased bleeding time due to impaired platelet aggregation. If you recall that bleeding time is just a laboratory measure of platelet plug formation, this should make sense, since Glanzmann Thrombasthenia only affects platelet aggregation via the GP2B3A receptors, but not platelet numbers. Other measures like platelet count are normal. Okay, things are getting really heated here. Let's recap what we've learned and get out of here. Glanzmann Thrombasthenia is an autosomal recessive platelet disorder caused by a defect in GP2B3A receptors on the surface of platelets. This causes an impairment in platelet aggregation and blocks the formation of platelet plugs. Clinically, patients with Glanzmann Thrombasthenia present with bleeding, such as mucosal bleeding from their gums, nosebleeds, and heavy menses. Laboratory tests reveal a prolonged bleeding time, although platelet counts remain normal. I think it's probably best to leave the inheritance battle to the lawyers. I'll see you in the next one.